Today's episode is brought to you by Microsoft Dragon Copilot, your AI assistant for clinical workflow, helping to ease administrative burden, automatically document care, streamline your workflow. How many workflows do you have?
About 1 million.
I've got the same on the medical side of things. And all of this, Microsoft Dragon Copilot helps to promote a more focused clinician-patient experience, which is really what it's all about, just trying to make your job a little bit easier. Learn about how Dragon Copilot can transform the way you work. Visit aka.ms/knock-knock-hi. Again, that's aka.ms/knock-knock-hi.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock Eye with me, your host, Dr. Glockenflecken. This is your one-stop shop for all things eyeballs. We're doing we've got a sale on eyeball stuff today. It's great. We've got some great stuff. A topic that has been requested so many times. I don't know why I haven't gotten to it yet, but we're going to do it. We're going to talk vision therapy. I get this question a lot from patients, not a lot, but more often than you think. And, but also in the comments, people who've been watching these, listening to these Knock Knock Eye episodes, they want to hear about vision therapy. So we're going to talk all about it. I've got mixed feelings, just this little teaser. So first though, eyeballs in the news. All right. It's usually not a good thing. Sometimes it's a good thing. Sometimes it's a cool new surgery. We got a robot suturing a grape skin or something like that, which is cool, but honestly not that useful. I don't know what the robotic future looks like for ophthalmology. It's just so tiny. Like, why? Surgeries don't take long. Why do we have to have a robot try to do cataract surgery? I've never understood this. Why must a robot do a 7-minute surgery? Don't understand it. 7 minutes, unless you're someone who sets reimbursement for cataract surgery, then the surgery takes 2.5 hours. Anyway, we're not talking about that. I'm talking about this thing that happened in the news. An NFL player, Indianapolis Colts quarterback Anthony Richardson, recently suffered an orbital fracture in a freak accident during pre-game warm-ups. And they say it's a freak accident, the news agencies, but as an ophthalmologist, no. This is not a freak accident. All right. This is a resistance band that snapped back and hit him in the eye. And man, to cause an orbital fracture, that's got to be some pretty strong, blunt force. But this is exactly why one of my least favorite things on earth are the bungee cords. Resistance bands I still feel a little bit uneasy when it comes to like using resistance bands. I do use them from time to time if I'm doing any kind of rehab for different various ailments. I've used resistance bands in the past. I think we have some in the house. I might be rethinking that. I don't know. But this, anything that snaps back, even rubber bands, kids shooting rubber bands at each other. Like, I've seen injuries from that. Now, an orbital fracture caused by one, that's one of the worst ones. I have seen a bungee cord injury that caused a blunt force open globe trauma. So there are a couple points on the eye where the wall of the eye, the sclera, is particularly weak. Behind your extraocular muscles, that's a weak point in the sclera. And also right at the edge of your cornea, where the white part of the eye starts. That is also a thinner part of the sclera. So those are the places where if you have a strong enough blunt trauma, you might end up with an open globe. But this resistance band snapped back, and people are like, it's a freak accident. Well, no, not really, because you're always looking at things that you're doing. So if you're stretching something, typically you're kind of looking at it, right? You're turning your head in the direction of that thing. And And I don't know, the fates, the things love to find the eyeballs somehow, but I think it's just mostly because we're looking at the things that we're doing. And so, it's unfortunate, and I hope he's okay. Orbital fractures, I saw those so often in residency. I mean, I remember there was a night I saw 6 or 7 orbital fractures in one night. Vast majority of the time, you don't require any surgery. There are certain things that would, if it's a large enough fracture, then maybe you have to fix it, or you put a little plate in the orbital floor. If the patient ends up having double vision after the fracture because you don't have the support of the bones, and so the eye can kind of sink down, and you can get strabismus, and so the eyes are not moving together. You might have to repair the fracture for that. Or just even a cosmetic appearance. Sometimes it can make the eye look different if it's more sunken in or sunken down. Then you do it for a cosmesis. But usually people do just fine as long as the eyeball is okay. I'm sure he got a nice dilated exam to make sure, and also making sure that there's no extraocular muscle entrapment. That's one of those pants patients we've talked about before. If there's extraocular muscle entrapment, restriction of the eye and up gaze, typically that's a surgery. You're getting surgery to fix that. I didn't hear that Anthony Richardson had surgery to fix this. So, but the other thing is how long it takes to heal. Like, it'll be swollen. His eye's gonna be swollen. He might have a little bit of pain with eye movements, so it'll knock you off the. You definitely don't want to play football for a few weeks. Maybe even probably like 3 to 4 weeks, I would guess. You want to obviously protect. I mean, they're wearing helmets, so this, obviously didn't happen while playing the game. But the biggest thing is you don't want to blow your nose for 3 weeks after a fracture because you have an opening now between your sinuses and the space around the eye. And so if you blow your nose too forcefully, you'll blow air up into the fracture, through the fracture, into the space around the eye. And it's painful. It's not going to usually cause a lot of problems. It's just it hurts. And so I always advise people not to blow your nose for a while. But it's always this is why I'll say it before. I've said it before and I'll say it again. Ophthalmologists need to be on the field, all right, present for every sporting event, particularly Chiefs games, and particularly me during Chiefs games. And I want to be able to watch the game from the field. Okay, that's all I'm saying. It makes perfect sense to me. I don't know. But let's get some ophthalmologists going here. So looks like, the status here is that Anthony Richardson update is that he was placed on injured reserve, so he'll miss at least the next 4 games, which seems about right for me. Missing 3 or 4 weeks, not that makes sense for that type of injury. Um, you don't want to mess around with eye trauma. It can be, since I saw a lot of it in Iowa, living amongst the farmers. Injuries happen, and not only injuries, but like dirty injuries, right? Injuries involving like farm equipment, grinding metal. That's a big one. And you got to be, you know, open globes are one thing, but when they're dirty wounds, that's when you really run into problems because when you don't want to get any dirt, any dusty, dirty environment, sawdust, any kind of vegetable matter. That's the worst thing you can get inside your eye. And which is why, after cataract surgery, I'm always telling people, like, stay out of those environments. For like a week at least, no woodworking, no gardening, no mowing the yard. Like, you have a fresh incision on your eye. You don't want any kind of plant material to get in there because then you're talking like intraocular fungal infections, um, any kind of severe bacterial infection, nasty things. Then you get endophthalmitis and it shows over. It's hard to come back from that. We do our best when patients get endophthalmitis. Fortunately, it's like 1 in 100,000 now. with endophthalmitis after a routine cataract surgery because cataract surgery is so fast and the incisions are so small that it protects you. It's less likely that you're going to have that. But yeah, it's scary. You sometimes you end up with surgery, certainly injections of medicine into the back part of your eye. So if that doesn't sound fun to you, having someone put a needle into your eye and inject medicine, then don't play with resistance bands or bungee cords. Wear safety glasses at all times when you're mowing the yard, when you're woodworking, when you're anything where there's projectiles potentially, wear those safety glasses and follow the instructions post-op. Like those are the best things you can do for yourself. All right, so let's take our first break and then we're going to get into a discussion about our eyeball topic for today, vision therapy. Hey, Kristen.
Yeah.
I know that you love when I talk about the cute little mites.
Mm-hmm.
Yeah, but I thought we could take a break from that. Is that okay with you?
That's fine.
Yeah, because I'd like to focus on the eyelid symptoms and disease that an overgrowth of Demodex causes.
Okay, I like that idea. No mite talk.
So Demodex blepharitis, it often gets misdiagnosed or just missed entirely because a lot of symptoms overlap with other eye conditions.
Okay, so what are the top symptoms that people should look out for?
Usually itching along the eyelid margins, swelling, irritation, redness.
That sounds like it could be allergies or lots of other things too.
It could be a lot of things, but exactly. And the key is if your doctor spots crusties on the margin of the eyelid.
Technical term.
Well, we call them collarettes, but crusties is a good term. That tells you it's Demodex blepharitis right there.
Well, I really like that there's a clear sign to know for sure.
And once you're diagnosed, there's a prescription eye drop treatment available for this disease.
Ooh, that is good to know.
To learn about the common symptoms of Demodex blepharitis and more, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, before we get to our topic, just real quick, I wanted to say thank you to everybody on the YouTube channel at Glock and Fleckens, all the subscribers who leave comments on the episodes, because I just posted recently the first video about my 40th birthday, where I just gave some like random advice. People appreciated the flossing advice. Although one person, I got to find this one. Oh, here we go. These are great comments. These at New England 8126 said, I'm 66 and cavity free and floss about once every 15 years. You know what we do? What we as a species, we discount the impact that genetics has on health. Like severely discount it. We don't even think about it a lot of the times. That's why someone who can smoke a pack a day for 50 years and never get lung cancer. That's the power of genetics. Someone can like not floss, maybe even not, I don't know if this person, I assume they brush their teeth, but someone can just neglect oral hygiene, but maybe they're just fine because their genetics are so good. They're not prone. It doesn't leave them open, susceptible to certain diseases. So it's, if that's you and you can get away with stuff like that because you have ironclad genetics, then more power to you. The rest of us are going to floss and not smoke cigarettes, obviously. But people, I appreciate all the well wishes and the happy birthdays. And people, let's see, people talking about, I did talk a little bit about LASIK. And in fact, just today, just on the LASIK topic before vision therapy, just today, I had a patient come in who is a cataract evaluation and signed her up for surgery. She's about, I think around 70. And she had LASIK. I was like, when did you get LASIK? And she was just about to turn 40 when she got LASIK. And she said, you know what? I didn't need reading glasses and they told me They told me I wouldn't need glasses for a little while, for at least a few years after LASIK. And then the next day, all of a sudden, I had to wear reading glasses. A tale as old as time, folks. If you are almost 40 and you're getting LASIK to give you good distance vision, you have to assume you will need reading glasses immediately after LASIK. Maybe not. Maybe it might take a year, but just in your mind, think, okay, I'm doing this. I will need reading glasses imminently. Do not listen to people that tell you otherwise. If you get LASIK for good distance vision in both eyes at or close to the age of 40, you will be in reading glasses very, 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 very soon. Trust me. Trust me on this. All right. There's bad actors out there. There's people that are really trying to do as much LASIK as possible who will underplay that in order to convince you to get it done. You can't fight it. You can't. Presbyopia, it comes for us all. All right. That's what I'd say it all the time. Death and presbyopia. If you live long enough, you end up with presbyopia, you end up with cataracts, there's nothing you can do about it. All right. All right. Let's see. A couple other people also took German in high school. I talked about how that was, I should have taken Spanish. There's still time. There's still time for me to learn Spanish, more than just the directions. Mira abajo. That's really bad. All right. Well, let's get to our topic, shall we? Okay. So, vision therapy. All right. Again, I'm not sure why I haven't done this, but people have recommended it. So vision therapy is, first of all, it's not something done by ophthalmologists. So you should know that. Um, MDs, DOs, we do not do vision therapy. So when you hear the term vision therapy, that is a term that is used by optometrists. Now, does that mean that it's all bogus? No. Some of it is bogus. All right. And so we're going to talk through what vision therapy is when someone mentions that term and how you can tell like when you should look into things like eye exercises and when you shouldn't. All right. So vision therapy is basically an attempt to develop or improve the visual skills, visual ability, eye tracking. Uh, uh, that's probably that's a big one. Things like increasing comfort of vision, how well the eyes work together, understanding visual stimuli, just the kind of functional components of vision. In a vision therapy program, is usually made up of in office, a combination of in office and home eye exercises, and the regimens typically last from weeks to months. Now, in addition to eye exercises, which we're going to get to in a bit, there are other things that might be prescribed for vision therapy, like quote unquote training glasses, which are typically a low power pair of glasses. So let's say a kid comes in, they're essentially plano, they don't need glasses. A vision therapist or someone who does an optometrist does vision therapy might prescribe a low power pair of basically reading glasses. Um, Prisms are sometimes used. Filters that you put on the eye to make the eye work a little harder in certain situations. Uh, uh, um, using like electronic targets and games and things to move the eyes back and forth. These are all parts of vision therapy, but there are three main types of vision therapy that are discussed. One is behavioral and perceptual vision therapy. So these are eye exercises to improve visual processing and understanding of what you're seeing. There's also vision therapy for prevention or treatment of myopia. And then the third one is orthoptic vision therapy, which is eye exercises that are used or done in an optometrist office or an orthoptist office or even an ophthalmologist office to fix a very specific problem. All right. So we're going to go through all of these things. Um, so first, let's talk about the first one, this behavioral perceptual vision therapy. This is sometimes, I think, recommended by people because a child is not showing interest in reading or having other behavioral problems, like, oh, check the vision, see if it's okay, and then maybe prescribe vision therapy to help with these behavioral issues, or to be able to help with reading. And there's no studies, no science that has shown that behavioral vision therapy works, that it does anything, that, in these kids, the vision system works just fine. There's other issues, attention, other behavioral issues that are not related to the function of the eyes. Uh, Training glasses. Let's talk about that. I talked about those like low power training glasses. So those are not helpful. All right. And it's usually just an expense. All right. Kids do not need, like, generally low power unless there's strabismus, unless there's eye misalignment, or high degrees of refractive error. Like a low power reading glasses, they're not necessary in kids. Okay, so a kid who is plano, or even slightly farsighted, like a +1, they don't need like a +2 pair of glasses. Or I've seen kids come in that have had that vision therapy, and they're plano, their prescription is plano, meaning they don't have a prescription, but they have like zero point 0.5 or a +1 pair of glasses that were prescribed to them that they spent money on, that the family spent money on. There's no reason for that. That's not necessary as long as it's not like fixing something like strabismus. That's a different issue. All right. But sometimes these are done under the guise of vision therapy. So let's talk about learning disabilities and dyslexia. This falls under this first category, this behavioral perceptual vision therapy. So does vision therapy help with learning disabilities or dyslexia? So there have been a lot of studies that have shown that eye coordination, eye movement, visual processing are usually normal in children with dyslexia. All right. So it's more just like an understanding, flipping words around, but it's not a vision issue. It's not a problem with the eyes moving around together. So eye exercises have not been shown to be useful to improve how well children with learning disabilities do with learning and schooling. All right. So we don't have no data to suggest that giving them eye exercise is going to help them do better in school, because it's not a problem with the vision system. All right. And I'm not an expert in learning disabilities. I am an expert in visual function. And I know that we don't have data that shows that learning disabilities are a cause of vision dysfunction that can be fixed with vision therapy. Okay. Let's keep going here. So the next one, and I'll say one more thing about that. So if you do, because I sympathize with like parents, because like if your kid has a learning disability, if he has dyslexia, you want to do everything in your power to try to fix that. And so if you see your pediatrician or you go see an eye doctor and or an optometrist, and they do recommend vision therapy, um, I I recommend that you get a second opinion, like with an ophthalmologist, and talk to them about that. And what you can also do is if it's an eye doctor that's recommending vision therapy, ask for studies, ask for data, look at that. And you can bring that to a physician and say, hey, does this look, if you're not well versed in like evaluating literature, you can bring it to your doctor and be like, what is it? What do you think about this? All right. It's okay. And I strongly encourage, getting another opinion by a physician when it comes to things like vision therapy. All right. So that's behavioral perceptual vision therapy, the first like kind of subset of vision therapy. And then we have vision therapy for prevention or treatment of myopia. This is not an effective way to treat myopia, to slow the progression of myopia or help myopia get better. If anybody tells you that vision therapy, eye exercises, can slow down or prevent myopia or reverse myopia, see a different doctor. Do not go back to that person. That is irresponsible and it's unethical because there's no data. I feel very strongly about this one because we do have some effective treatments. Atropine treatment has been shown to have a mild effect on slowing down myopia. Now, nothing is going to reverse myopia. Myopia is a result of the eyes getting bigger. And you can't shrink the eye. The eye will just get bigger, but you can slow that down. We have lots of good studies that show that atropine therapy can do that for kids with families with strong family history of high myopia, pathologic myopia. You got everybody in your family is like a -8, -9, -10 or higher. If it were me, I would absolutely look into atropine treatment, low dose atropine, to try to slow that down as much as possible. All right. So that is an effective treatment at slowing down myopia, not vision therapy, not eye exercises. Don't let people try to convince you otherwise. All right. And by the way, I don't want people to think that I'm just bashing on optometrists when I'm talking about this, because that's not what I'm doing. It is true that the people that do vision therapy and prescribe vision therapy are almost universally optometrists, but it's not every optometrist. And I promise you, not all of them are recommending that you do it for myopia. In fact, I see more claims about reversing myopia with eye exercises in the wellness industry than anywhere else. All right. So just be careful on social media. That's where you're going to hear some of this stuff. Okay, so let's move on to the third part, which is more like orthoptic vision therapies. These are just the eye exercises themselves, as prescribed by optometrists, orthoptists, which are typically orthoptists are they're vision specialists that work with ophthalmologists typically, usually in pediatrics. They work with prisms, they work with strabismus, and so they are fantastic collaborators on the eye care team. So orthoptic eye exercises are prescribed by an eye doctor, either an optometrist or an ophthalmologist, and that can help in a very particular subset of patients. So that's why I don't want you to think that I'm saying that all eye exercises are useless. That is not true. There is a disease called convergence insufficiency that can be helpful. So let's take a break and then we'll come back and talk about convergence insufficiency. Okay, so convergence insufficiency is a fairly common problem that usually manifests when it shows up in young people, either young adults or in kids. It's sometimes double vision, but usually we'll see double vision a little bit more with like older kids. But there can be some doubling of vision, usually with near TAT. So it's a problem mostly with near vision. And so with prolonged reading or playing, or kids will either describe intermittent double vision, but most often headaches, brow aches, blurry vision sometimes. And it's always with prolonged near work because the eyes are having trouble converging together on an object in front of you. That's what your eyes do. Both eyes, there's a pathway that leads to convergence of your eyes. there's also a pathway that leads to divergence of your eyes. Like if you go from looking at your finger in front of you, your eyes converge. But then if you go to look at, the wall across the room, your eyes will diverge. All right. There's pathways that allow you to do that. Well, for some people, for some kids, that convergence is more challenging to maintain. And so you're having to contract these little muscles that help you try to keep you have to try really hard, and sometimes they can't even do it. That's why you get double vision, because they're trying to focus in front of them, but they're just having trouble maintaining that position of the eyes. And so they end up with headaches. They end up with double vision. All right. Um, Now, this is also something that gets more difficult once you get into your 40s, because that's when, again, presbyopia hits and you start having more trouble moving those eyes in and focusing up close. That's a slightly different problem. But convergence insufficiency is something that we treat with eye exercises. We call them pencil push-ups. That's kind of the old way of doing it, where you hold a pencil in front of you and you kind of slowly back it out and you slowly bring it back in. It kind of trains the eyes to just give a boost to your your convergence. And so that's something that now there's like computer programs that help accomplish this much more efficiently. So it's like we prescribe like homework. You do this computer program, or if you can't afford the computer program, do with a pencil, do it, every day. You're doing this in the evenings before bed. You're sitting there, you're doing these pencil push-ups. You're moving this thing in and out, just training your eyes on improving convergence. But that's really it, right? This is not something that you prescribe to help with myopia, or to decrease your incidence of cataracts, or macular degeneration, or improve glaucoma, or stave glaucoma away. Which are all claims that I have seen on social media, that eye exercises can do all of these things. No, no, not at all. All right. So don't believe any of that. So eye exercises can be useful, but in a very specific way and for a very specific indication. Um, I think that's all I have about vision therapy. So, well, here's kind of a corollary thing. When should you get your kid's vision checked? All right. So how do I know if my kid needs this stuff? Well, I think I've mentioned this before, maybe even recently in one of the kind of the episodes where I've given all my 40-year-old life advice. Um, you should have the vision checked early in life, before kindergarten. So by age 4, I think, is a good rule of thumb, because by age 4, kids can read the chart fairly well, or at least recognize and be able to verbalize symbols if they can't do letters yet. So you can get that's the first age where you can really get a decent indication of what the vision acuity is. And that's when you can pick up things like strabismus, eye misalignment, amblyopia, where the kid's just ignoring one eye. And so the vision declines because they're not using it. So the brain's not going to develop the ability to see well on that side. And that's when you start doing patching, right? You patch the good eye. You like force the kid, okay, you're not going to use your good eye that you want to use all the time. We're going to cover that eye a few hours a day or all the time, and force you to learn how to see with your bad eye. That's the idea behind patching, to treat lazy eye or amblyopia. Vision therapy doesn't do that. That's not a thing, right? Um, So you can find more information about vision therapy and kind of what's evidence-based, what's not evidence-based, on the American Academy of Ophthalmology's website. The American Association of Pediatric Ophthalmology and Strabismus, APOS, is another great resource. Also, just learning about, as a parent, about learning disabilities. The National Center for Learning Disabilities, the International Dyslexia Association. You can find all like accurate information, up-to-date research about these disorders. All right. But above all else, like vision therapy, again, certain indications for very, very specific things. And so don't hesitate to get a second opinion if somebody in your life recommends vision therapy. All right. That's okay. It's okay that you should do that. You should seek that out because you want to be as informed as a parent and as possible. Okay. Let's see. I think that's it. That's what I got for vision therapy. Again, thanks to all the birthday well wishes again, and you guys got me thinking I need to get Rosetta Stone again. I think I tried that once to try to learn. One more. Let me do one more comment that I really appreciated this. So at Spiky Green said, "Happy birthday, Dr. Flannery. Thanks for the videos." Who's Dr. Flannery? Who is that? I don't know who that is. Speaking of a great, you give me a great topic for a future video. Any tips for communicating with doctors, especially when you have a complex and relatively unique situation? At this point, I make a one-page summary of my questions and just hand it to my surgeon. I actually really like that. If you are the type of person that forgets like that you had a question, like write it down. Now, your doctor, might not be able to get to like all 20 of your questions for that visit, but certainly the most pressing ones, right? And get through as much as you can. But it does help to organize the visit, right? And I know exactly if I get one of these from my patients, I know exactly like what they're worried about, what they're interested in, and I can really focus my conversation with them on what is at the front of their mind, and it's going to save time. So I think that's a wonderful approach, is by writing down the questions. Absolutely, I think that's great. And so I appreciate that. I don't think there's really, as far as communicating with your doctor, I think that's more than enough. That's more than most people do, and don't be afraid to ask all your questions if you want. That's okay. That's what we're there for. That's what we have the expertise. And if we don't know the answer, I'll tell you, I'm not sure. If it's something I think I can figure out, then I'll look it up for you and I'll let you know, or I'll give you a call later on, let you know what the answer is. So, because we don't know everything, but it's certainly okay for patients and families to challenge us, and give us thought-provoking questions about the eyes that maybe we just haven't thought about, or just letting us know about your experience and why certain things are the way they are with your vision. Probe our expertise. Do it. That's what we're there for. All right, I want to thank you all for listening. I'm your host, Dr. Glaucom Flecken. This was Knock Knock Eye. And once again, go check out the YouTube channel at Glaucom Fleckens. All of these episodes are posted there, and I see a lot of the comments that come through on those videos. So check it out. Executive producers are Aaron Corney, Rob Goldman, and Shanti Brooke. Editor and engineer is Jason Pertiza. Our music is by Omer Benzvi. Knock Knock Eye is a human content production. We'll see you next time, everyone.
Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts, or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.